Do you know the early symptoms of diabetes you shouldn't ignore? Diabetes is a prevalent health condition that can have serious consequences if not managed properly. Many times it's the subtle early symptoms that go unnoticed, leading to delayed diagnosis and treatment. Recognizing these early signs can be the first step towards effective management and control of this disease. We're about to embark on a journey to understand these symptoms better. Stay with us as we explore the early warning signs of diabetes. First on our list is frequent urination. This is a common early symptom of diabetes and often a cause for concern. It usually manifests as a sudden increase in the number of trips to the bathroom, especially during the night. But why does this happen? Well, when you have diabetes, your body struggles to regulate sugar levels. This excess sugar in your bloodstream is, quite literally, too much for your body to handle. To cope, your kidneys go into overdrive, trying to filter and absorb the excess sugar. But when they can't keep up, the surplus sugar is expelled from your body through urination. Now, this isn't your body being overzealous, it's just trying to maintain a healthy balance. Yet, this can put a strain on your kidneys over time. So if you find yourself visiting the bathroom more often, it might be worth getting checked. Next up, increased thirst. Have you ever felt a seemingly insatiable need for water, even after gulping down glass after glass? This can be more than just an annoyance. It could be a symptom of diabetes. Often, excessive thirst goes hand in hand with frequent urination, another common symptom of diabetes. Here's why. When your body fails to effectively use the sugar in your blood, your kidneys work overtime to filter and absorb the excess sugar. But sometimes, they can't keep up. The extra sugar is excreted into your urine, dragging along fluids from your tissues. This triggers more frequent urination, which may leave you dehydrated and feeling thirsty. So if you find yourself reaching for the water bottle more often than usual, take note. It's not about being overly cautious. It's about being aware. If you constantly feel parched, despite drinking lots of water, it could be a sign of diabetes. Third on our list is hunger pangs. Now imagine this. You've just had a hearty meal, but you're still feeling hungry. It's like your stomach is a bottomless pit, constantly demanding more food. What's happening here? Well, this constant hunger, even after eating, could be a symptom of diabetes. Here's why. Our bodies break down the food we eat into glucose, which our cells use for energy. But in people with diabetes, this glucose can't enter the cells as easily. This means the cells aren't getting the energy they need, which can make you feel hungry all the time. So you eat more in an attempt to fuel your body, but it's like trying to fill a leaky bucket. No matter how much you pour in, it's never enough. Persistent hunger, regardless of how much you eat, could be a signal that something's not right. At number 4, we have fatigue. When we say fatigue, we're not talking about the typical tiredness you feel after a long day. We're referring to a persistent sense of exhaustion that doesn't go away with rest. This lingering fatigue can be a sign of diabetes. But why is that? It's because your body's cells aren't receiving enough glucose. Glucose is the primary source of energy for your body's cells. When you have diabetes, your body either can't produce enough insulin to move glucose into your cells, or it's resistant to the effects of insulin. Either way, your cells aren't getting the fuel they need, and you're left feeling constantly worn down. It's like trying to run a car without enough gas. It just won't work efficiently. So if you're feeling chronically fatigued, it might be more than just lack of sleep. It might be your body's way of telling you something's not quite right. Feeling constantly drained? It might be more than just lack of sleep. Halfway through our list, we have blurred vision. High blood sugar levels can wreak havoc on your eyesight, leading to a condition known as blurry vision. This isn't just a minor inconvenience. Blurred vision can be an early warning sign of diabetes. Here's how it works. Excess sugar in your bloodstream pulls fluid from your tissues, including the lenses of your eyes. This can affect your ability to focus and see clearly. It's like looking at the world through a fogged-up window. If left unchecked, this symptom can escalate to severe eye conditions, including retinopathy, glaucoma, and even blindness. What's important to note is that just like the other symptoms we've discussed, blurred vision doesn't necessarily mean you have diabetes. It could be due to other health conditions or simply a need for a new pair of glasses. But if you're noticing a frequent fuzziness in your vision, it's certainly a signal that it's time to schedule an appointment with your doctor. Coming up next is slow healing. Have you noticed that your cuts, scrapes, or sores are taking longer than usual to heal? This could be more than just an inconvenience. It might be an early sign of diabetes. High sugar levels in your body can slow down the healing process. Here's why. When your blood sugar levels are elevated, it can cause inflammation and damage to your blood vessels. This can restrict the flow of nutrients and oxygen to the areas that need healing, causing a delay in the healing process. In addition, high sugar levels can weaken the immune system, making it harder for your body to fight off infections. So, those nicks and scrapes that used to heal in no time? If they're now lingering longer than they should, it's worth paying attention to. Notice your cuts and bruises taking their sweet time to heal? It could be a symptom of diabetes. At number 7, we have unintentional weight loss. When your body can't effectively use glucose, it might resort to burning fat for energy. This action can lead to unintentional weight loss, a potential sign of diabetes. Now, we're not talking about a pound or two. Significant weight loss over a short period, especially without a change in diet or exercise, is the key indicator. Your body begins to dip into its fat stores, breaking them down into energy because it's unable to process glucose properly. This process, while sounding like a dieter's dream, is far from healthy. It's a desperate measure taken by your body when it's not getting the energy it needs from glucose. This can lead to a host of other health problems, including fatigue and a weakened immune system. So if you're shedding pounds without trying, don't just shrug it off. If the scales are tipping and you're not trying to lose weight, it's important to find out why. Next is tingling or numbness. Have you ever felt a prickling sensation in your hands or feet? That sensation of pins and needles, often described as tingling or numbness, might not just be a case of your foot falling asleep. It could be an early sign of diabetes. This is because high levels of blood sugar, a hallmark of diabetes, can cause damage to your nerves over time. This nerve damage, known as diabetic neuropathy, often starts in the extremities like your hands or feet. So an unexplained tingling or numbness, especially if it's persistent, should never be ignored. As with all symptoms, it's important not to jump to conclusions. But if you notice this sensation, especially alongside any of the other symptoms we've discussed, it's definitely worth bringing up with your healthcare provider. Experiencing pins and needles without a clear cause? It might be time to talk to your doctor. Coming up at number 9 is dark skin patches. A rather peculiar symptom, wouldn't you agree? However, it's more common than you might think. A condition called acanthosis nigricans is characterized by the development of dark, velvety patches on the skin. These patches are not random, but tend to appear in areas where the skin folds or creases. That could be your neck, armpits, or even under the breasts. So, why does this happen? Well, insulin resistance, a key factor in the development of type 2 diabetes, can cause changes in the skin. High levels of insulin in the blood can trigger skin cells to reproduce at an accelerated rate, and as these cells grow, they may produce more melanin, leading to the dark patches you see. It's important to note that having dark skin patches does not mean you definitely have diabetes, but it could be a sign. If you notice dark patches on your skin, particularly where your skin folds, it could be a sign of diabetes. Last but not least, we have irritability. Now we all have our off days, right? But when irritability becomes a constant companion, it might be a sign of something more serious. As it turns out, persistent irritability and mood changes can be an early symptom of diabetes. But why is that? Well, when your body's glucose levels are out of whack, it doesn't just affect your physical health. It can also impact your brain function, leading to mood swings and increased irritability. It's your body's way of telling you that something isn't right. So if you find yourself snapping at loved ones, feeling unusually grumpy, or simply not feeling like your usual self, it might be time to pay a visit to your healthcare provider. And remember, early detection is key in managing diabetes. Feeling unusually irritable or moody? It could be more than just a bad day. And that wraps up our list of early symptoms of diabetes. These signs should never be overlooked as they might indicate the onset of diabetes. Your health should always be a priority. Remember, early detection is key in managing diabetes. If you're experiencing any of these symptoms, do not ignore them. Consult with your healthcare provider immediately.